H.R. 2477, the Beneficiary Enrollment Notification and Eligibility Simplification Act of 2019, as amended, includes 4 policies that improve Medicare enrollment, access, and quality of care. First, the BENES Act, as I shall continue to call it, introduced by my colleague, Representative Raul Ruiz, fills a longstanding gap in education for older adults and people with disabilities, eliminating needless multi-month coverage gaps in Medicare by mandating that Part B insurance begin the first month of the following an individual's enrollment during both and the later months of the beneficiary's initial enrollment period and during the general enrollment period. The BENES Act also provides increased notification to better inform older adults and people with disabilities about Medicare eligibility enrollment. The BENES Act also allows the federal government to create a Part B special enrollment period for exceptional circumstances like natural disasters. Complex Medicare enrollment rules and inadequate notification cause tens of thousands of older adults and people with disabilities to face lifetime fines, coverage gaps, and other harmful consequences. Individuals who miss their initial Medicare enrollment window may pay lifetime late enrollment penalties, experience lengthy gaps in outpatient health coverage, or face unaffordable and unexpected out-of-pocket health care costs. The bill under consideration today also includes 2 provisions based on legislation, again, championed by Ron Kind of Wisconsin. The first will provide access to the immunosuppressive therapy to individuals after a kidney transplant. I have heard from the Hartford Hospital Kidney Transplant Group and National Kidney Foundation how vitally important this legislation is, and I am pleased that it is included. The second provision will make improvements to reporting regarding Medicare Advantage enrollees between the Center for Medicare and Medicaid Services and liability and non-group health plans to improve financial accountability. Finally, H.R. 2477 includes language from H.R. 5821, the bipartisan Helping Our Senior Population in Comfort Environments Act, or the Hospice Act, introduced by Ways and Means colleagues, Representatives Jimmy Panetta and Tom Reed. This policy addresses vital program integrity concerns identified by the Department of Health and Human Services offices of the Inspector General in 2019 through a series of much-needed reforms that provided additional oversight and transparency of Medicare hospice providers. The changes in this bill align the HH Secretary oversight tools with those of other Medicare providers, including skilled nursing facilities and home health providers. These reforms are vital to improving the quality of care delivered to some of the most vulnerable patients in the healthcare system. I urge my colleagues to support this legislation, and I reserve the balance of my time.